In this film, the cast and splint removal of the forearm will be demonstrated. For cast removal, the following instruments and materials are needed: an oscillating cast removal saw, bandage scissors, a cast spreader, and optionally, a strip of plastic which can be placed underneath the cast during cast removal, as it may be stressful for patients, especially children. This strip can be used to comfort patients who are afraid that the saw may cause skin injury. The patient is placed in a comfortable position with the arm supported. The cast will be split over the dorsal aspect of the forearm. Care must be taken to avoid splitting the cast over the ulnar styloid process or the radial styloid process. These protrusions have thinner covering of skin and subcutaneous tissue, and the risk of skin injury is therefore slightly larger over these parts compared to the dorsal aspect of the forearm. An oscillating saw will be used. Because of the oscillating movement of the saw blade, the skin is not injured. It is advised to demonstrate this to the patient as well, to reassure the patient that the saw will not injure the skin. As mentioned before, a plastic strip can be placed under the cast before removal to comfort patients who are afraid of the saw. As this is an option only, the strip is now removed and splitting the cast is started proximally. Note that the second digit of the orthopedic cast technician rests against the cast to stabilize the saw. This allows for more precise movements of the saw. The saw is positioned perpendicular to the surface of the cast and is slowly moved in and out of the cast. This is continued until the entire cast is split. Note that both sides move independently when pushing onto the cast. This is a clear sign that the cast is split completely. The cast spreader is used to separate both parts to expose the underlying padding. The padding can be cut using bandage scissors. Care is taken to use bandage scissors with rounded points so as not to injure the skin. The padding is cut layer by layer. It can be useful to separate the cast manually, so cutting the padding is easier. After the padding is cut, the stockinette is the only layer left. This last layer is cut, again making sure as to not injure the skin. The plaster is pulled apart, so it can be removed from the forearm. It is recommended to provide some physical exercises to improve muscle strength of the affected arm. Next, the removal of a splint will be demonstrated, in this case an ulnar gutter splint. Again, care is taken to use bandage scissors with a rounded point. The elastic wrap and padding are cut over the splintless area, in this case the radial side of the forearm. The stockinette is cut, and the splint is removed. Again, it is recommended to provide some physical exercises to improve muscle strength.